everyone, and welcome again to my weekly Sunday 9 p.m. live video. I'm Dr. Tani Ping, consultant obstetrician and gynecologist. Today's topic is upon request by one of you. Previously, I have done one video on miscarriages and pregnancy loss. If you have missed that, you can go to my YouTube channel at Dr. Tan City Clinic and please watch that video on miscarriages and pregnancy loss, okay? Remember to subscribe to my YouTube channel and to like my video. Today, we're going to talk about recurrent miscarriages. Recurrent miscarriages is a bit different from just a normal miscarriage because it happens again and again. By definition, recurrent miscarriages is defined by 3 miscarriages, consecutive miscarriages. So it's defined by 3 consecutive miscarriages. First of all, we want to define what is miscarriage. Miscarriage is pregnancy loss within the first trimester. So usually we are talking about within the first 12 weeks to 14 weeks. But recurrent, when it comes to recurrent, then it is usually we call 3 consecutive miscarriages. So if you have 3 consecutive miscarriages, then we call it recurrent miscarriages. So many people think they have recurrent, but actually it's not, because some people they have like 1 miscarriage, then got 1 baby, and then after that another 2 more miscarriage. So they have 1 live baby in between. They do not define as a recurrent miscarriage, because the reasons for recurrent miscarriage is very specific and very special. And if your miscarriage is not really recurrent, then the reasons for it may not be exactly the same. But when you have recurrent miscarriages, what you need to do? When you have recurrent miscarriages, the thing that you need to do is we need to investigate. But the indication for investigation is not after 3 miscarriage. Actually, when I was first a doctor, like 10-20 years ago, we only investigate after 3 times miscarriage. So you have 3 times, then you investigate. But it's very distressing, to a lot of couples when they have like 2 miscarriages already. They're so stressed already. They already have 2 and there's no live baby in between. They're very stressed out and they just want to know what's going on and why again and again. So over the years, over the last 10 years, the world bodies have actually changed the guideline. Previously, our guideline is 3 miscarriages and we were like so strict, you like 2 times, we don't investigate, we wait 1 more. 3 only we investigate. Now no more already. The guidelines changed to 2, because all along also I always feel, why make people wait until 3? After 2 is already so stressful. Why wait until 3? So even after 2 miscarriages, we can also start to investigate. So the reasons for recurrent miscarriages is quite more or less overlap with the reasons for miscarriage, but certain reasons for miscarriage are more likely to be recurrent than certain other reasons for miscarriage. So let's go back to what are the reasons for miscarriage. I always say there are 3 reasons. In my last video also I would say there's 3 reasons. I group them into 3. The first reason is, we always say, is genetic. Something in the DNA material not right. Either with the egg or the sperm, or when they combine together, they form something that is not viable. Not viable means that pregnancy cannot survive, cannot go on to survive, cannot form a fully healthy baby. So when a pregnancy is not viable, it will die off during the first trimester, so we call that a miscarriage. So if you get a miscarriage, one of the reasons could still be genetic or DNA, but it can be hereditary or not hereditary. So sometimes, because many people will say, do I need to check my gene? So sometimes you check your gene, you may be able to get an answer, but in most cases, you cannot get an answer. But when you talk about recurrent, if you talk about 1-time miscarriage, sometimes we may be able to find something, but sometimes we may not be able. But when you talk about recurrent, it's very rare to be due to genetic reason. Very rare. But very rare. In certain people, they because of the age factor, so they have a chance of getting a recurrent abnormal baby. I have seen cases where one pregnancy is an Edwards syndrome, second pregnancy is a DiGeorge syndrome, and it's always an abnormal baby. So that's why they end up having miscarriages again and again. But in these cases, it's very, very rare. It is very, very rare for recurrent miscarriages, because we usually say all these things should just happen one time and that's it. It should just happen one time and that's it, because it's not hereditary, because you do not have the genetic material. Your husband also doesn't have the genetic material, and you should not be getting it again and again. And then if you look at this case, one day Edward, one day George, is actually totally not related. See, it's not related, but it just so happened to happen again. So these are not common reasons for recurrent, because usually when recurrent, we are talking about reasons that are always the same reason. The same reason is always there, so it's always keep coming. But it can, about 1% of recurrent miscarriages is due to genetic issues, and so that's why sometimes we will test genetic as well, but we rarely do that. Number 2, the second group of reason of why people get recurrent miscarriage is illnesses within the lady itself. The wife or the husband have certain illnesses that we can discover. Previously, we always talk about wife, and now the latest research, we know that husband also counts. So there's some illnesses that we can discover one. That means there is some test that we can do to you or your husband, and then we can find that, oh, there is a problem there. So what are the tests that we can do? Husband, usually we do a sperm test. When you do a sperm test, if you have ever done a sperm test, you will know that a sperm test, when you do, there's a series of results from quality to quantity. And there's one particular aspect of a sperm test, we call that normal and abnormal form sperm. Normal and abnormal form sperm. So if you have normal form sperm that is so small, let's say only 1% or less than 1%, then there is a very, very high chance that the sperm can be a reason for the miscarriage. Because you must understand that in pregnancy, millions and millions of sperms are produced during sex, and these millions of sperms, they will, we know that they actually like having a race, they race each other to see who reached the egg first and who fertilized the egg first. But if, let's say, in theory, it should be the best sperm, so it should be always a good sperm. Theoretically, that should be the way. But because in small number of people, they actually have so little normal sperm. So because they have so little normal sperm, so even the ones that reach there may not be a normal sperm. So if your normal form sperm is like 1% or less, and your abnormal sperm is like 99%, 98%, then there is still a reason, there is still a possibility that the husband is the reason for the recurrent miscarriages. But more so, we always talk about the woman, because there are many reasons why a lady gets miscarriage. Physical reasons on the uterus like fibroids, adenomyosis, endometriosis. These are one of the reasons for recurrent miscarriages as well. Other than that, things that we discover through blood tests like diabetes, thyroid issues, as well as we call antiphospholipid syndrome. Diabetes and thyroid problem, they are not so like 100% miscarriage. They have more miscarriages, but if you keep getting pregnant and keep getting pregnant, they somehow will have some okay baby one, because it's not 100% miscarriage, but they can have a bit more miscarriages than the rest. And because of that, sometimes if you are not so lucky, maybe the first 2 happen to be miscarriage, maybe the 3rd one will be okay, or the 4th one will be okay. But they tend to have a bit more miscarriages than healthy pregnancies, so they can be also a reason for recurrent miscarriages. And when we talk about diabetes, it doesn't have to be very, very bad diabetes. It can be just borderline diabetes. Like women with polycystic ovarian syndrome, they have borderline diabetes, they have higher risk of miscarriages as well. That's why I always tell a lot of polycystic women, I say it's so difficult to get you pregnant. And unfortunately, even if you're pregnant, the chances of miscarriage is very high. So, but anyway, it's preventable. And the one thing that is like almost 100% miscarriage is antiphospholipid syndrome. Antiphospholipid syndrome, I have seen some women, 5 pregnancies, 8 pregnancies, 10 pregnancies, and they just go on again and again and again with a miscarriage. So these people are like almost always miscarriage. Other medical problem that end up with miscarriage is like if both of you have thalassemia, but this one can be grouped under genetic as well. because some thalassemias do not survive. They always end up with miscarriage. So that is also one possibility, especially the alpha thalassemia. And another situation is a rhesus blood group. You know, our blood group, we got A, B or O, but we got positive and negative. Rhesus negative is when you have a blood group that is negative. A lady with blood group negative also have higher chance of miscarriages if she has developed sensitization towards the rhesus. So some women, not all women that is negative, women that blood group negative is, if taken care properly, should not have this situation. But in some cases, maybe for some reason somebody didn't treat her properly in her previous part of her life before she was pregnant, and subsequently she has this immunity, develop this antibody towards rhesus, and that is when they actually get multiple miscarriages, and it's quite difficult to handle actually these cases. But it is very rare because most people would have been treated properly. Okay, so these are reasons where you can actually do a blood test. You can actually do a blood test to know, to find out why you have miscarriage. And the third group of reason is purely psychological. So a lot of women, they don't realize that psychology actually contribute almost half of all miscarriages. So you have another one big group of miscarriages that you can do whatever test in the world, you just can't find the reason. And one of the reasons why you can't find the reason is because it is not something that is physical related. You must understand that if you are very stressed in a pregnancy, or you have a certain very strong fear in pregnancy, that is when you also cause problem. Because when you have fear, you have a lot of fear-related chemicals that are released from your body. And these fear-related chemicals can cause blood vessels to constrict. It can cause blood vessels to constrict. So if your blood vessel were to constrict, then there's no more blood vessels that go into the uterus. And then, of course, the pregnancy will die off. So these cases, I also have some that I'm going to share with you. I have this one lady, she has some fibroids and fertility issues as well. So she came to me, we removed the fibroid. And then during the course of doing the surgery, I found out that she has some endometriosis. So in endometriosis, usually I will stop her menses for 6 months. So stop her menses for 6 months, that's fine. But after that 6 months, she still could not get her menses. 7 months, no menses. 8 months, no menses. Then she's curious, why I got no menses so long? Is there something wrong with the injection or the surgery? So when she came to see me and we scanned, oh my God, that is a baby, and there's a 2-month-old baby, healthy and fine. But she was in the shock. She did not expect the pregnancy. And that night itself, she had some bleeding. Then the next day she came to see me, and then she asked me, Doctor, when I didn't know I'm pregnant, why I got no bleeding? Why when I know when I'm pregnant, why after I know I'm pregnant, I got bleeding? So I told her, most likely stress related. Are you thinking too much yesterday after you know you're pregnant? Then she agreed. Okay, well and fine. We gave her some medication, she go back. But 1 week later, she had a miscarriage. This lady, I sent her to see my therapist. Some of you know my clinic does have a group, has a team of therapists that deal with women's problem. So I sent her to my therapist. And after we sent her to therapist, then we realized that there are actually a lot of issues that she have. That's why when she got pregnant, she's actually very stressed. Very, very stressed. And that's why she had the miscarriage. But after she's seen our therapist, the next time when she got pregnant again, there was no problem. It was a live pregnancy. But this is a story that I want to share. But there's another story that's so typical of why psychological illness causes miscarriage. It's not illness, it's psychological stress. This lady already got miscarriage 3-4 times already. Not just once, but 3 to 4 rounds already. She has so many miscarriages. She has seen so many gynae and never seemed to solve a problem, and nobody know what's wrong with her. She come to me with all the tests done already, blood test, what test, all done already. Everything is normal, but she's still she's still getting miscarriages. So I told her the only thing that other doctors have not done is asking you to see a counselor or therapist. So I asked her to see my therapist, and there was so much issue. She cried so much in her therapy session because she has so much fear because of what happened to her husband. Her husband almost died. The husband died in an accident where he was burnt. It's a burn injury, very badly burnt. Her trauma of seeing her husband at the emergency in the hospital is very traumatic for her. So there's always this worry that something's going to happen to her husband. There's always this worry that the husband will die, something will happen to her husband, because that injury happened to her husband at work. And now, even though the husband has survived, the husband is still doing the same work. So you see, there is a lot of fear, a lot of worry. And as a result, she got so many miscarriages. So after she saw my therapist for probably five sessions or so, that is when she managed to settle all her issues. She cried a lot, yes, but that is the way we want you to release. So all her fears and her worries were resolved, and then she got pregnant, and bravo, she had a healthy pregnancy, and the child is quite big now. So these are situations that we can see that actually psychological fear, psychological issues can cause miscarriage. And the problem is, some people, they have a worry that they will miscarriage again. That reminds me of this particular case. I think also 3 or 4 time miscarriage. Okay, what happened is her first pregnancy actually no miscarriage, but after about 3-4 months, the doctor found out that the baby got problem. I think some Edwards syndrome, something like that. So the baby had to be aborted. Actually, it's a live baby. There's no miscarriage, but we have to sacrifice the baby. So we have to ask the patient to abort the baby, because no point. Edwards syndrome will not survive anyway, and it's so abnormal. You might as well abort the baby. No point you keep, right? So she aborted the baby at about 4 months. Then second round, when she got pregnant, she only discovered about the Edward at 4 months when they saw something is not right on the ultrasound scan. So this time, having that history, so she has decided she will do a test to make sure her baby is normal. So the test is usually done at about 11 to 12 weeks. So it's usually done at 11 to 12 weeks. And what happened? At 10 weeks, her baby's heart stopped. Her baby's heart stopped 1 week before she's supposed to do the test to see whether her baby is normal or not. Funny, isn't it? Okay, maybe it's coincidental. Okay, this one miscarriage settled. Then she get pregnant again. And this time, the baby's heart stopped at 6 weeks. Why at 6 weeks? So when she told me, I told her, first, I still think it's psychological related, because it's not a typical recurrent miscarriage. Because you see, the first pregnancy wasn't a miscarriage. It's just that we found out the baby was abnormal. If we didn't do anything, that baby would continue to survive until 9 months. But only thing, Edwards always die within the first week of life. So it wasn't a miscarriage at first. But anyway, she didn't believe me. So I said, it's okay, let's do all the blood tests. And true enough, all blood tests was normal. All blood tests was normal, sperm test was normal, everything was normal. What happens in this case is that, you see, the first time she had an Edward, what do you think will happen in her second pregnancy? I am sure she is worried that she have an abnormal baby again. So scared that her baby even died 1 week before her test. After her second experience, what would she learn from her second experience? Her second experience taught her one thing, that babies don't need to have any problem, can also suddenly no heartbeat one. So in her third pregnancy, naturally she will be very worried for no heartbeat. So she's very worried for no heartbeat. And as a result, the baby now no heartbeat even earlier. But she didn't believe what I say, so she wanted to do all the tests normal. Then the fourth pregnancy, again, she didn't believe that it is due to psychology. I asked her to see my therapist, she die won't see. Okay, it's fine, you don't want to see. So she got pregnant again, and then this time, maybe she said it's a baby abnormal. So I say, fine, let's test the baby. Because to know whether it's genetic abnormality, we can always test the baby. So when she abort, we send the baby to go and test for genetic. And the baby was a totally healthy baby genetically. She was like, oh, you're so sayang. It was a baby boy. When you do genetic test, you know exactly already, boy, girl, and everything. He was a totally normal baby. This time, only she willing to go and see therapist. So these are incidences that show you that actually psychological impact does have a big impact on miscarriage. And as I say, almost half of all miscarriages is psychologically related. Because you can do all the tests, you can't find a problem. But if you do a test and you find a problem, that is good news lah. Because almost all problem can solve. Actually, almost all reasons for miscarriage has a solution. If let's say it is a genetic problem, very easy. Don't get pregnant on your own. You can always opt to do IVF, because IVF now you can have PGD, PGS, where you can test the baby before they put it into you. So in the test tube, I can really test the baby to make sure it is a good baby. So you can go and do IVF if it's a genetic issue. Even for thalassemia, there are a lot of women, there are some women who face like more than one thalassemia major that ended up with miscarriage, and they're so scared to get pregnant again. It is also very simple. Just go and do IVF. We can make sure your baby have no thalassemia before we put it into you. So genetic related issues is very easy to solve, just need to do IVF. If you're talking about sperm related issues, again we can do IVF and we choose the good sperm. If you're talking about blood related issues, if you're diabetic, if you're polycystic ovarian syndrome, very easy. We just need to control your sugar with either glucophage or insulin, and that could prevent the miscarriage. I had actually most cases with glucophage is enough, but I had one very much more extreme case where after glucophage she also miscarried another 2 times, and then finally we put her on insulin, and with the insulin she had a nice and healthy baby. If it's a thyroid issue, it's again very easy. We have to solve your thyroid issue. And some people, it's not a recent thyroid issue, but it's an old thyroid issue, but the thyroid antibodies are still very high. Again, it can be prevented by medication. And also APS, which is short for antiphospholipid syndrome. Although in antiphospholipid syndrome, the miscarriage rate is almost 100%, but again, this is preventable by either taking aspirin or with heparin injection. So it is again preventable. In fact, I have seen many of all these antiphospholipid syndrome with like 5 miscarriages, 7 miscarriages. All you need to start treatment on them and then problem solved. And I still remember this one lady that is, I always remember her because she's very tiny and cute. And she has like 4 or 5 miscarriages already. So we just put her on aspirin and injection, and that's it. After that, she had totally 3 babies, all fully. So she had like that 4 or 5 miscarriages at the beginning, and then at the end she has with the injection she got another 3 more pregnancy and no more miscarriage after that. But I have also some women that are very cute, you know, they have a few miscarriages and then we found out why, and then we gave them medication, and then they have a nice baby, and then the next pregnancy, they never come and see us, they think they should be okay, then they got pregnant again, but they miscarriage again. So you know, when you have recurrent miscarriage, you do not get pregnant on your own. You please take medication before you get pregnant, especially you already know the reason why you miscarriage, and you also know for that particular reason you need to take medication to prevent miscarriage. That all you need to do is to take the medication to prevent miscarriage. And for psychological stress, as I mentioned earlier, a lot of women actually go into a lot of vicious cycle. I have seen really many. The first one could be an ectopic pregnancy. The first one could be like just now that case, an abnormal baby. The first one could be molar pregnancy. So all these are abnormal pregnancies. But because of one very bad experience, or even the first one could be a healthy pregnancy, but with a birth trauma. Have a birth trauma. I still remember this case. Never had miscarriage before. And then what happened was that when she gave birth, she had a birth trauma, very bad trauma. What happened? She pushed her baby, cannot come out. Doctor do vacuum, cannot come out. Then someone scissor her. I can tell you that is a very horrible thing to go through. Ever since that incident, 3 times miscarriage. 3 times. I told her to see my therapist. She didn't want to see, so I don't know how to help her anymore. Because it is her trauma. You do not just simply get miscarriages like that. Because when she asked me why miscarriage, I say most likely due to a trauma. Then she just sat in front there and all in tears. She just burst out in tears. I say most likely due to your birth. I'm sure the birth still affects you. Then she was just crying. Because you must understand, for these people, getting pregnant is not an issue, but the moment they're pregnant, they will start remembering what happened in the past, what I have to go through now. They're so scared to go through again the birth process. So that could also be one of the reasons. So many I have seen birth trauma, previous molar pregnancy, first pregnancy, molar pregnancy, first pregnancy, ectopic, first pregnancy, abnormal baby, and subsequently it goes on and on and on and become multiple miscarriages after that. These people can solve one. Very easy to help them, because number one, they get pregnant so easily. The fact that they can get pregnant 3-4 times, they can get pregnant another 10 times, but you need to get them out of this vicious cycle. They have a vicious cycle, and the vicious cycle gets worse and worse with each miscarriage. First time happened, they scared already to get pregnant, and then because of their fear, they got a miscarriage. Then after that miscarriage, the next time they more scared already. They're so scared. I have so many people, they're so scared, they come and see doctor, they're so scared. Ultrasound scan show no heartbeat. So scared. You see, they come and see doctor, heart rate 120, 130, so scared. When I see these people with heart rate 120, 130, I already know the only reason why they have a miscarriage is because of fear. And the only way to solve that problem is to see the therapist. There's no medication that will help them. So, but thankfully I have a team with me. I have helped many women get out of this vicious cycle. I have helped many women, countless, because my team has been there since 2014. We have been around for a long time. So we have helped really many women to get out of this vicious cycle. So yeah, so that's all I have to say about this recurrent miscarriage. So now you know that it is 3 main groups and all problems are solvable. So it is very sad to see women still having miscarriages when all problems are solvable. Got one pregnant one mother, 26. Then after first vaccine, she miscarried due to uterus contraction. You have to please practice. I need to know what vaccine you're talking about. Number one, I don't think any vaccination causes miscarriages or uterus contraction. So there is more to it. Okay? So because no vaccines actually cause miscarriages or uterus contraction, and normally we don't give vaccine during the first 3 months, which is the period for miscarriage. If you get it, if you are already week 26, then you also do not have miscarriages anymore, okay? Because miscarriages, by definition, it should be the first half of pregnancy and not towards the end. Hello, Dr. Tan. It said that insulin resistance is the cause of miscarriages. Yes, insulin resistance is the cause of miscarriage. That's why I talk about diabetes, borderline diabetes, as well as polycystic ovarian syndrome. It's a toxic that enters through the placenta. What's your opinion on using myo-inositol on insulin-resistant women? It seems that this supplement helps to improve. Yes, it improves insulin sensitivity, so it actually helps in improving your ovulation, your menstrual cycle, as well as pregnancy rates, but when you must understand that myo-inositol in the first place, there are not that many researchers out there, but it is quite well documented and accepted that it can help in improving your menstrual cycle and your ovulation. But when it comes to miscarriages, I don't think it is well researched. So for miscarriages, we still feel that glucophage is the main line. Okay. So can myo-inositol be used together with metformin or glucophage? Yes, metformin and glucophage is the same thing, alright? Can, but not during pregnancy, okay? So it's for before pregnancy, because myo-inositol is mainly used for regulation of menses and ovulation. So in that, of course, you will more likely to be able to get a successful pregnancy. I have this particular formula that I work for people with miscarriages. So everyone comes, everybody gets an entire screening. So entire screening of all the reasons of why you miscarriage, and if I find something, then I will start you on treatment. If I don't find anything, then I'll send you to see my therapist, and after you see my therapist and my therapist already clear you, that means she feels that you have no issues anymore and all situations settle, and then I actually will put you on some treatment as well. I'll put you on some treatment before you start pregnant. So that is the formula that I work on all these years, okay? And it has been quite successful. Shobana asked that even with metformin 2000 insulin still high, does losing weight is the only option to regulate back your insulin? Are there any options? Of course, there are many options, Shobana. There's many options. There's so many medication out there for diabetes. You need to really get the optimum dose. It's not just metformin, maybe you need to add other things. Basically, you need to add other things to perfect your whole sugar control. I have PCOS, miscarriage once without any medication, baby no heartbeat at 10 weeks. A year later, I got pregnant, given metformin throughout the pregnancy. Next pregnancy, I hope I can do it without metformin. Is it possible? Well, you want to try, up to you, but generally, we always feel that people who need metformin always need metformin. Why? Partly, you could get lucky, as I said that earlier. Diabetes also, not all pregnancy will end up with miscarriage. They tend to have more miscarriages than other people, but it's not all pregnancy will end up miscarriage. So maybe the next time you never take anything, but still at the same time you do not end up miscarriage. It could be if you are lucky, but if you're not so lucky, you may again end up with miscarriage. I'm not sure whether you want to take the chance, because if I were you, I would still take, because generally speaking, women as they grow older, sugar control usually worse, insulin usually higher. So it is usually your situation now is by right should be worse than before. So use that type of logic. By right, you should go back on metformin. As I mentioned earlier, I didn't say too much details on the psychological aspect. I mentioned about blood vessels because it's something that is a lot easier to imagine and understand, because when you have fear or stress, especially when you have fear, a lot of people, when you suddenly get shocked or scared, your whole face turn pale because the blood vessels shrink. But in the actual thing that happen when you have stress, there are a lot of things that are being released by your body. So I like to, since you mentioned it, yes, because I normally tend not to mention it that you are actually killing your own baby. But in many situations, that is exactly what's happening. In certain pregnancy, it is the mother that rejects the pregnancy. The mother that rejects the pregnancy. Such things does happen. So that's why when they go and see therapists, you will realize that in some cases, it is actually purely the mother reject the pregnancy, either due to psychological aspect or even in endometriosis. In endometriosis, it is a very toxic situation. Adenomyosis is also toxic. It actually kills the baby. So there are situations where pregnancies actually end up miscarriage because of so-called natural killer cells. Actually, our body kills the pregnancy either through chemicals, through cells, or through reducing the blood vessels. Reducing the blood vessel to the uterus is also due to chemicals. So all these things, the body work on its own. So it is in a way the mother reject the pregnancy. But question is, why the mother reject the pregnancy? Many of these reasons that we mentioned earlier, even like antibodies, thyroid antibodies, all these are, a lot of things are the mother reject the pregnancy. So yes, in a way you kill your own pregnancy. So that is why we just basically need to find out the reason why it happens. What is the cause of you having the miscarriage? The exact cellular level or biochemical level as to how it happens, sometimes can be quite not so easy to explain and not easy to understand. But basically, we know what happens and why it happens, and we know what are the medication to give. Okay. Milky Way asks, good evening, I'm 36 and I have one child 7 years old, had subsequent pregnancy, unfortunately it's ectopic, then third one I lost heartbeat at 10 weeks, what can I do? Okay, you see, you have 3 different pregnancy with 3 different reasons, okay, 3 different issues. So you have one very healthy pregnancy, but unfortunately you have an ectopic pregnancy, and the third one is a miscarriage. So you have only one miscarriage. So we do not know whether this one miscarriage is going to end up with recurrent or just one time off. So we actually do not know, because if you go back and look at my video on miscarriage, so those people who just have one time off, it is very common. And very often it could be like in your case, it's age related. But this is a one time off, it may not happen again. Honestly, if you're happy with your first pregnancy and you have fully accepted your ectopic pregnancy and have no more fear for your ectopic pregnancy, and also fully accepted your miscarriages and would welcome whatever that comes, you do not need therapy. But if you have issues with this that I mentioned, that means maybe your first pregnancy has been eventful and you are quite scared to go through another pregnancy or birth, or you are worried that you will get an ectopic pregnancy because ectopic pregnancy can be traumatizing to certain people, and you are very scared of getting an ectopic pregnancy, or you are very scared of getting a miscarriage and you may not be able to accept a miscarriage or ectopic pregnancy, then you need to go therapy. So before I end my session today, so remember to go to my YouTube channel, Dr. Tan City Clinic. If you have missed previous videos on polycystic ovarian syndrome or pregnancy loss and miscarriages, you can go to my YouTube channel and look for it, okay? Remember to subscribe to my YouTube channel and like my videos, okay? And also remember to turn on the notification button, okay? So, okay, it looks like there are no more questions, so that's all for today. See you again next week, same day, same time. Bye-bye.